6th, D-Day. First American soldiers hit the beach.
Thousands of soldiers died this day, but thousands of others lived thanks to a revolutionary system of caring for the wounded.
Aid stations are established on the spot, and an astounding record starts piling up. 80 to 90% of the wounded receive medical care within 10 minutes of being hit.
Many of those who survived their wounds on D-Day and since owe their lives to the insight and dedication of Michael DeBakey.
Well, in the military, surgery becomes of great importance from the standpoint of trauma. So we were trying to develop the logistics, so to speak, of care of the wounded. We had what we call general hospitals in place, and we had what we called field units, which were first aid sort of units. But the distance between the front lines and the general hospital was quite a bit. It may be 100 miles. And it occurred to us that if we could put a surgical unit, field surgical unit, that could do severe and acute trauma cases, like wounds of the chest and wounds of the abdomen. Most of these individuals, when injured in that fashion, would die before they could be brought to the general hospital.
That bloody day changed the course of World War II. Dr. DeBakey's forward surgical units changed the course of battlefield medicine.
And that gradually evolved into what we call the auxiliary surgical units. And we put them in a field hospital that was mobile, you see. Later on, of course, they became the mobile auxiliary surgical unit hospital. And that's how it became MASH, Mobile Auxiliary Surgical Hospital.
MASH is one of the most memorable series in the history of television. The characters, Hawkeye and Trapper John and company, have become part of American culture.
Can we have some quiet in here?
Don't bleed so loud.
In many ways, the wisecracking surgeons of the 4077 epitomize the American hero. Cool, confident, and bold, using skills to fight for what's right. That description also fits another battlefield surgeon, Michael DeBakey, the real-life hero of MASH.